tell me a little bit about your cancer journey?
Sure. So I'm a two-time cancer survivor, which is kind of unique, I guess. But I had breast cancer originally. It's been probably 15 years, and so I'm doing really well with that. But then I had a really interesting diagnosis, neuroendocrine cancer, and that was about 8 years ago. And that one is very different, very unique, doesn't have a lot of known protocols, very individualistic care. And so I had kind of thought I knew about cancer and kind of thought I'd check that box. And then a few years later, here comes a different one that is so different that we actually use a zebra stripe to use the analogy that, all stripes are different, that sort of thing. So so in the course of all of my cancer treatments, I've had, multiple surgeries. I've had a lot of systemic treatments, chemotherapy, radiation. Most recently, I finished up a brand new treatment for neuroendocrine cancer called PRRT, or Lutathera, is the drug that's used in that. It's a nuclear therapy. And I just finished that up in mid-February. So I have been through a lot of, life changes over, since literally 2005. So in some weird ways, I think that cancer patients perhaps are, even though we're more vulnerable because of the current pandemic, we're also used to kind of dealing with the unknown and maybe are more equipped from just a washing our hands and a sanitation standpoint to kind of deal with this. So it's really a weird place to be, knowing that you have a lot of tools because of what you've already learned through this journey. At the same time, it's scary because you understand that it makes you more vulnerable to the virus.
Yeah, definitely. So then that kind of ties into our next question. So as a patient, have you really felt the impact of COVID-19, whether it be through the social distancing that we're doing, or, obviously there's, delays in treatment, surgeries, doctor's appointments, things like that?
Yeah, I mean, immediately, my first thought was, I just finished a major treatment. And this treatment began the end of last summer. And then the cycle was 4 treatments over the course of 8 weeks. And I actually traveled to do those treatments because I chose a doctor in New York who was one of the, world experts really on this type of treatment. And so I literally just finished the treatment in mid-February. So that gave me pause to go, okay, first of all, I'm really glad that I finished the treatment, that I don't have to go back to New York right away. But at the same time, does this make me more vulnerable? And so, I had a lot of questions about that. So immediately I was reaching out to my doctor, to ask those questions when this kind of first started appearing on the scene. And then, I started thinking about what I had already been doing as a result of my treatment, which was social distancing because it was a nuclear therapy, right? So for about a couple of weeks afterwards, I had to kind of socially distance, even from my husband at home, and practice a lot of sanitary measures. They basically told me, act like you have a really bad cold, okay? So I was already doing a lot of those things. So I said, okay, I'm going to have to continue doing all of those things. But then, I work, go to an office. A couple of weeks ago, made the decision that we needed to, all stay at home. So we're staying at home and working from home. And that has its own, trying to figure out how that works when you've got people that, are normally working together in different locations and trying to figure all that out. And then, going to the grocery store, running errands. You just stop and think about all that. And, and now it's like, we haven't done the home delivery yet, but, in going to the grocery store, the last time we went, it was kind of like, okay, here's your list. Here's my list. We're going to go in 10 minutes in and out. I do have a mask that I wore during my treatment. And so it's just a weird world, to try to adapt to all that. And then, I tend to be an empathetic person anyway. And so watching the news and seeing what people are going through, seeing what the healthcare workers, because I work with doctors and nurses, in what I do. And so seeing them and what they're going through, and then my own husband being in healthcare, it's just, there's a lot of things swirling around in the head, as to, am I doing enough, and what can I do to help, anyone else that's going through this?
Yeah. Yeah. So you mentioned your husband there. Now he is a hospice worker. Yeah. Yeah.
Yes.
And then, given that line of work that he's in, did he have any advice for you during this whole situation that maybe you could share with others, or?
Wash your hands, wash your hands, wash your hands. So when I would visit his work, they always had, the dispensers on the wall there where, in and out, you would do that. And he would always, be really stern with me, about using that. And I would kind of roll my eyes like, okay, well, he's always practiced this. And he said, I probably wash my hands 3 times every 5 minutes. This is, his world, and which is hard to imagine to me. So that's been his best advice. The other thing was, we had a serious discussion about a week ago about the fact that he is in healthcare. He could be exposed to something, bring it home to me. I'm slightly compromised because of my age and because of my cancer treatments. And so we've socially distanced at home. We've actually keeping separate bedrooms, separate bathrooms. We cook in the same kitchen, but we kind of try to sort of maintain that, 6 feet apart, wash our hands a lot, sanitize things, so we made that decision. And I know he worries about me, he really, and he's actually been talking to his supervisors a lot about, what they're doing there to keep everyone safe. And they're doing a really good job. They're doing the best they can, but it worries him. It's on his mind constantly that he's going to bring something home. Goes and takes a shower the minute he comes in the door and changes his clothes, just things that, a month ago, we would have never thought about any of this.
Yeah, no, it's definitely turning everybody kind of upside down here. But then now, kind of switching gears a little bit, you're the executive director of the Healing Net Foundation. Now, that foundation, this organization, aims to help those with neuroendocrine cancer through education, collaboration, things like that. So how is the foundation doing during this pandemic?
We're doing fine. I mean, we're working from home. We're trying to stay connected with everyone. We had to make a really difficult decision, and we actually did this early on. We do a major, what we call summit every year, where we bring together the experts, expert physicians, as well as some nurses, nurse practitioners, a few patient advocates. We bring them together in an annual summit. It's a very close-knit community. We share a lot of information about what's new in the world, what's new in the NET community, but also, where those gaps are, where the needs are that maybe in ways that we can work together and collaborate better to fill those needs. And so we have that scheduled actually in Nashville, the first weekend in April. And so right around March 5th, we started seeing this coming, and a lot of our doctors were starting to get issued travel bans. We have a couple of international doctors who come. They said that we can't come. And so we had to make kind of the painful decision to cancel the summit. And we were also getting ready to launch a new initiative, which would have utilized some of the faculty at our summit, some of those NET experts, to teach other physicians in the community about neuroendocrine tumors. And that's a huge gap that we have in the medical world, is that, there are a lot of physicians, even oncologists, who don't completely understand neuroendocrine cancer. And so when patients present, they may not know the latest treatments and the latest options that are available. So we were going to convene a new boot camp for these physicians, and we're very excited about that. We test piloted it earlier at a small hospital up in Ohio. We were so excited about this. Had to cancel the whole thing. We postponed it. We're hoping that it will happen later this year, but we'll see. So that's on hold. Meanwhile, what we're trying to do right now is just provide the best resources that we can, particularly to the patients, to try to put their fears at ease. So because we have these connections with the physicians, we've created a resource page on our website. It's thehealingnet.org. and you can click on resources. There's a place there to find some topics that our NET patients can relate to during COVID-19. Should you continue your treatments and go to the clinic? How does that work? What about surgery? What about PRRT? What if I'm in the middle of that? What if I'm getting ready to start that? What happens there? And so, and then there's also telemedicine. That's a new area that, a lot of doctors and patients are learning to use in this. So we're trying to provide those resources to the community, and trying to, as a nonprofit, also trying to maintain our presence and ask people, like, when they're shopping, if they're shopping online, don't forget, whether it's Amazon Smile or iGive or whatever, to, help us out, to keep us going, because we anticipate that, the economic crisis that is coming from all of this is also going to impact nonprofits quite dramatically.
Yeah. Now, speaking of just the impact in general, we touched on this a little bit earlier, but are there currently any treatments for NETs that can put patients at an increased risk, say chemo versus other treatments that you just mentioned?
Sure. Well, a lot of neuroendocrine patients don't take chemo unless they are of a high grade variety, and there has been an increase in some of those cases that I've just seen in the NET community. So that's definitely a concern for those who are taking chemotherapy, because as we have heard, that is something that can suppress the immune system and make people more vulnerable to the virus. The PRRT, and again, I'm not a physician, so I'm relying on our experts, to give us this information. But, as I understand it, that, one of the risks when you're taking the PRRT treatment is, that you get a low white blood count, and that, compromises your immune system. So what's most important, I think, is that you're communicating with your physician, your treating physician. You make sure that your blood counts are where they need to be. If there's some concern, say on your last blood count, and that you need to have your blood tested again, then you probably need to do that, and be as safe as possible when you go to the lab to do that. Make sure that you keep your distance, that you wash your hands in and out, and all of that. Probably wear a mask, just to protect yourself. So to me, what's most important is that you have that good communication with your physician. Now, some people are asking the question, what if I'm getting ready to start PRRT? I'm going to have to go to a clinic and all of that. And then there's all the protocols I need to follow afterwards. What, should I do that right now? And so the advice with that is that if you can wait, if you're, and a lot of neuroendocrine tumors are not aggressive growing. A lot of them are, low grade. Then it might be best to put it off, 9 to 12 weeks, before you start it. Because once you start it, it's typically on an 8-week cycle. Some people have said, what if I've started it? Would it be a problem for me to have to wait, a few weeks, past that 8-week? Again, discuss with your doctor, but most likely you could, and it wouldn't affect your overall, response to the treatment. So these are all questions that I, tell everyone it's really important to talk to your doctor about this. And it's very individualistic. If you're having the treatment, at a hospital that's in your community and you feel comfortable going there, that's one thing. If you're traveling on a plane like I was to New York, if I was in the middle of it right now, I would probably postpone a few weeks, or I would wait to start my treatment. And then there's surgery. A lot of questions have been, should I, put off surgery? And I think this is a particular concern for patients who have been newly diagnosed. Because when you've been told you have cancer, the first thing you want is, I don't want that cancer in my body anymore. I want it out. And so it makes people really nervous, the thought of postponing surgery. Again, talk to your surgeon about this, but because a lot of neuroendocrine tumors in particular are slow growing, it might be okay to put off that surgery, say 9 to 12 weeks, until things, hopefully calm down and we kind of get over this curve. So, again, it all comes back to having that good communication with the doctor, which is something we really stress and we really try to provide good resources for. We actually have on our website, we have what we call a net primer. It's written for doctors, but it talks about the patient-physician relationship and how important that is. And so this is a time where you can really lean on that if you've been able to establish that communication. If for whatever reason you don't feel like you have good communication with your physician, I suggest, reaching out to a nurse practitioner in the practice or a nurse that can maybe spend more time with you and answer your questions. And at the very least, try to connect with a really good community. There's lots of support groups out there. They all have online capability. So I really encourage people to reach out to, other people who are going through this. And, not to second guess your doctor, but to get support and to find out what other people are doing and how they're handling this.
That's great. Do you have any other advice for others in this situation?
Fear is a big and real thing. And fear is what causes panic to set in. And I think that, my biggest advice right now is don't panic and try to alleviate fear by, again, going to those trusted resources, about your own situation. But I also think that if you spend too much time, listening to the news and all the stories, it can really pull you down and pull you into a place that, it robs you of joy, and we all need joy in our lives every single day. So, my personal practice has been, and I was very fortunate to be the recipient of a health coach several months ago. And one of the things that I learned through that is that if I get up in the morning and immediately tune into the news and, get on my phone and start doing all that, it can paralyze me, because even before COVID-19, there was a lot of, crazy news out there, right? It wasn't necessarily joyful. And so I start my day with, a practice, some type of practice that gives me joy, whether it's reading something, whether it's prayer, whether it's meditation, yoga, exercise, just having a cup of coffee and, sitting out on the deck, or if you don't have a deck, looking out a window where you can see the outside world and see something beautiful. Just do something that gives you some type of joy to start your day. And then try to limit your exposure, to the internet and to the news. I tend to watch it only in the evening, and I try to limit that time. I think that technology has been a saving grace for us in this time. It really has. I mean, what we're doing right now, people being able to do telemedicine, people being able to keep in touch with family through whether it's FaceTime or Zoom or whatever it is, they've been able to do that. But at the same time, technology can, if we get too dependent on it, or if we spend all of our time on there, looking at stories that, we have no control over, it can really rob us of now. And, none of us know, what time we have. We don't know what that timeline is. So spending that time in now and really focusing on, what we need to do on a daily basis to get us through that day and to bring us joy in that day, I think is really, really important right now.